All right, there we go. So we are recording. Let's get started here. All right, here I am. Okay, so let's get the people in the waiting room to come in and join us. All right, let's begin. All right, everybody set? Everybody can hear me okay? Want to make sure, give me a thumbs up or something. All right, so I've got this recording. Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. So today's session is rotator cuff rehab. It's all about keeping your shoulder strong and stable. We're going to learn the role of the rotator cuff in shoulder function and how injuries occur, especially in overhead sports like reaching overhead, throwing, and we're going to learn safe strengthening and stretching techniques to improve shoulder stability. A little bit about me. I'm a doctor of physical therapy, owner of PAR5 PT. I got my BS in exercise physiology from Rutgers University. I'm also a certified orthopedic clinical specialist, certified dry needling specialist, certified CrossFit level 1 coach, certified golf medical professional, golf fitness instructor, and let's make this session as interactive as possible. So if you have any questions, feel free to use the chat button, and we're gonna make this as helpful and informative as possible. All right, so let's pull up my slide here. Where are we at? Oops. Okay, I'm gonna go this. Here we go. So hopefully you guys can see that, and I cannot see my slides. Excellent, very good. All right, so let's just kind of hit this. There we go. All right, so let's back this up a little bit, let everybody see the title card. Yeah, rotator cuff rehab, keeping your shoulder stable, right? That's what we're here for, all right? And if you've been to any of my lectures or classes before, you've probably seen this. This is basically the slide that says everything that we're going to be talking about today is very helpful information, but aimed at a general audience, a general population. So if you're dealing with something specific, some type of shoulder issue or rotator cuff issue, the stuff that we're going to be talking about today is helpful, it's useful, but make sure that you have a thorough physical exam to have all of your associated factors and causes of your injury addressed. All right, because the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result, okay? So if we look at the shoulder, there's actually a couple of things that we have to be focused on. The shoulder joint is designed to be a mobile joint. It's one of the most mobile joints of our body. So much degrees of freedom, moving around in big space movements. But the muscles or the segments that are connected to it, say the scapula, which is your shoulder blade, that's designed to be stable. And if we don't have good position and control of the shoulder blade, then the shoulder, which is supposed to be mobile, might turn into a stable segment, which may make it more tight or limited range of motion or stiff. The other thing that's important is also the thoracic spine, the T-spine. It's your ribs, it's your mid-back. That needs to be mobile as well, because if we cannot put our mid-back or our thoracic spine in a good position, then that disrupts the ability for the shoulder blade to function well, and then in turn disrupts the ability for the shoulder joint to move well. And also, I've experienced clients that have issues with the elbow. But the elbow is supposed to be stable, but if we can't move and control that elbow very well, if something's going on with the elbow, then that can compromise the shoulder. So everything is connected. Now, if we kind of just dive in and look at the bones of the joint, the shoulder blade is called a scapula, right? It's this big flat triangle piece of bone here where there's a lot of muscles, specifically the rotator cuff muscles, that originate from the shoulder blade and then go into the ball in the ball and socket joint. The ball is part of the humerus, which is the upper arm. All right, so if we zoom in just real quick here, let me just pull this up. And I'm going to show you this and then maybe put in my little laser pointer. What we have here is this big bump, greater tuberosity, and up top here, the acromion. The acromion is part of the shoulder blade that forms the top, the roof of the socket. And then you can see actually the glenoid, which is a small piece of part of the bone here, that is actually the socket or the articulating joint surface of the humerus to the scapula. Now, we got the top, there's the acromion and the greater tuberosity. This will become important later because the whole thing is connected with muscles and tendons that run through this section right here and can get impinged with certain movements, pinching the greater tuberosity up against the acromion, which can cause pain. So that's typically what can happen. And there's also the bicep tendon that runs in that space too. And you can probably see that little groove right through here. That groove is for the bicep tendon, and that runs up and then attaches to the part of the scapula there. So that also runs through this space, which is the subacromial space, we call it, and is the spot that most likely impingement or pinching happens. All right. So the next thing is, what is the rotator cuff and what is its purpose? The rotator cuff is basically four different muscles, four small muscles: the supraspinatus, infraspinatus, the teres minor, and the subscapularis. Now, what do? They basically take this ball and keep it in the middle of the socket as it moves around. So, right, so if we have the socket and we have the ball, it sits in there. If there's some slippage of this ball off axis or riding up, then we have less space, more pinching of the tendons in between the bones. The job of the rotator cuff is to control that and make sure that as you're moving, as the bigger muscles of the shoulder pull and move the bone, that ball stays in the middle of the axis of the joint so that we have the most space inside there and less likelihood of impingement. I think I've got a video here that kind of shows a little bit of the supraspinatus, where the location is, the infraspinatus, and then teres minor, and it switches around to the subscapularis. So all those, just kind of four things, just wrapping it up, keeping them in there. All right, so these rotator cuff muscles. All right, and then the next one, let me see if this will play. I want to see the video. Let me see. Am I going to hit this? Yes. There it is. All right, now it's playing. So you can see this. The purpose is to kind of keep that ball in the socket as the arm moves. And you can see there's not a lot of space in that joint. And then we can get a lot of pinching when the deltoid muscle is too active, because that's a strong, big muscle compared to these tiny ones, the rotator cuff muscles that pull the shoulder blade into socket. All right, so I think this is the last video, or is it the same one? Yes, it is the same one. Let's kind of fast forward. There you go. So there's another picture, an explanation of the position of these tendons, which are structures that connect bone to muscle or muscle to bone. And the tendon of that long head of the bicep tendon, you can see that kind of wrap up underneath there. And that is also another tendon that can get impinged, especially with a lot of overhead movements. All right. So then we have the other muscles of the shoulder or the upper back, the trapezius muscle. So this trapezius muscle is super big. You can see it. It comes from the back of your head all the way down to the mid part of your back and out to the shoulder blade. There's three parts to it, three parts: upper, middle, and lower. Now, oftentimes with people with bad posture, sitting, whatever, I see this all the time in my practice, is that the upper trapezius is very active. It just kind of like rides up like that. And when the upper trapezius is very active, stays strong, stays on, it stays tight, it inhibits the ability for the lower and middle to work, or robs the strength from the lower and middle trapezius and gives it to the upper trapezius, a very dominant upper trapezius muscle. Most people have this problem. So what that does is, because the lower and middle don't function as well, they're weak, that inhibits the ability for this shoulder blade, which sits on the back of your ribs, to rotate up or rotate up. I guess that's a picture you're seeing on the right shoulder here, as it rotates up as your arm goes up. Well, oftentimes, if it's just the upper trap that kind of does all the work, then we have this hiking of the shoulder. It just kind of comes up like this, and then people raise their arm like this, versus being able to dissociate the arm bone from the shoulder blade and have the shoulder blade rotate and the arm bone kind of move independently. So lower trapezius is one of the key muscles that has to be strong to control this upward rotation of the shoulder blade. The other one is this thing called the serratus anterior. Now that starts on the lower half of your shoulder blade and then dives into the ribs. And when that contracts, it takes that lower end of the shoulder blade, that pointy end, and moves it forward, which creates this upward rotation, again, of the shoulder blade, and takes the socket, instead of pointing it down, points it up whenever you raise your arm. So that's basically the anatomy and the way that the shoulder functions with all these tendons. Now, this video here is showing what happens if we get impingement. If we get this superior or upward riding of the ball, then we've got this pinchiness, and then here we go, a little bit of partial tear, tendinitis, tendinosis of that tendon, and then we get pain. All right, so that's subacromial impingement. All right, so now what do we do about it? How do we keep our shoulders healthy? So let me pull up my other slide here, and then let's go through the list. All right, so we got me here. We got me here. We're looking at the shoulder. The main thing is that first, we need to have full range of motion, all right? So if I take my arm and I'm going up over my head, this might look like full range of motion, but if I turn to the side, it's not. Full overhead range of motion is really about 170, 180 degrees overhead, maybe like bicep to ear, while maintaining good thoracic or spine stability. I don't want to go over my head and then arch my back. All right. So those are some of the movements that people compensate with when they get their arms overhead. All right. So strengthening, real easy. We want to be able to hit all of these rotator cuff muscles. So I've got a simple band. And if I attach this band to somewhere to the side, like say, for example, a wall, a handle, a doorknob, or whatever, I attach it generally around elbow height. And you've probably seen this exercise before. It's basically this external rotation. And a lot of people will do this and not understand why you're doing it or the proper technique. So the main thing is, as we externally rotate, we want to maintain this little space between my elbow and my rib. I definitely don't want to have it tight in here and then rotate horizontally, okay? Because that creates a wringing out of this tendon, right? We don't want to twist that tendon. We want to give it space and have that tendon, that supraspinatus tendon specifically, move through a range of motion that it's designed to work in. So the angle and movement is going to be somewhere between elbow height and then maybe above elbow height. Because of the angle of my upper arm, I'm not totally abducted or really close to my ribs. I'm a little bit away, and that changes the angle of my movement. If I keep my elbow bent at 90 degrees, you could see that it's 90 degrees here and it's 90 degrees there. So I move and it's slightly out and up and then slightly in and down. So the movement is like this. And as I'm doing this, I want to work through a pain-free range of motion, concentrating on proper posture, chest out, shoulders back, and not letting my shoulder kind of come forward or up, okay? So I'm going to get a little bit closer so you can kind of see. We want to maintain good position of that shoulder blade and control the lowering or the release of that tendon, okay? So what I like to do, and I program this with a lot of my clients, is that if you're going to do this move, you should be able to do it for a high number of repetitions, all right? Somewhere between 12 to 15 or until fatigue. And you do that for at least 3 to 4 sets with a 30 to 45-second rest in between. All right, because we don't really want to make these muscles, I mean, we want them to be strong, but we also want to improve their endurance, being able to work for prolonged periods of time to create that tension and control our shoulder. The other one is going to be the opposite way, pulling in. And then pulling in, because we're working on this subscapularis muscle, it internally rotates the shoulder versus external rotation, which is outwards. We can go horizontal. And with that, hopefully you can see this. I attach the band again to something at elbow height, and I'm going to pull across the body. And this typically tends to be a lot easier because there's a lot more musculature that rotates the arm in versus rotating the arm out. So this one we could add a little bit more resistance. Again, I'm not changing the angle of my elbow. I'm just rotating through the shoulder. And as I'm doing this motion, I don't want to bring my shoulder forward as I do that. So I'm maintaining that a relationship. And the same thing for the out direction. If I'm pulling out, I don't want to go through such a large range of motion that I create a change in that angle. This is what I see. I see people attach this to something, and then they start to go out, and they'll be like, all right, here I am. I'm coming in, and I'm out. And then what that is that I'm changing the angle of my elbow, or I'm going this way, and I'm trying to go really far. It's not about the distance that you go. It's really about the control. Can you control that angle and then make the rotation happen around the shoulder joint, not at the elbow? Because a lot of times people will compensate through elbow motion. All right, so we got those things. And then we have to work that other supraspinatus muscle a little bit more, teres minor, by kind of coming here and here. So it's a horizontal to a vertical position. So it looks like this, horizontal to vertical, with my elbow slightly in front of my body. So I don't want to be like out here and then kind of doing it, just slightly in front. The rotation is around the elbow joint, and I'm coming horizontal to vertical. So how do we introduce that? So I have the band somewhere below me, maybe at elbow height, same height that we had before, and I control my elbow position. Don't extend the elbow, so I'm not going out here. I'm just rotating around the shoulder. So it's vertical to horizontal. So you could see that in both cameras there. My elbow's pointed directly to this camera, the smaller camera. And you can see in the front here, I want to try and make this at 90 degrees at the elbow. And then I'm coming up to 90 and I'm down. So this is in front of me. I'm kind of rotating this up and back direction. Okay, so those are the rotator cuff muscles. We're talking about rotation. Now, we talked about lower trapezius and serratus anterior. Serratus anterior is a pretty easy one. All the serratus anterior does is it takes your arm, your shoulder blade, and pushes it forward. Now, hopefully you can see this on camera, is that when I push this forward, I'm not bringing my shoulder up. I'm not bending or straightening my arm, my elbow. I'm just sliding my shoulder blade forward, and I'm letting that come back. So sliding that shoulder blade forward and letting that come back. Keeping my hand in what we call neutral, thumb up, or external rotation when I do that. So that'll activate that muscle a little bit more. I never want to try and just do this like this, because this is less efficient in recruiting that serratus anterior. So what I do is I just take the band and I could wrap this around my back, and I put my hands in this position, and I can kind of slide my hands forward. For more advanced angle of pull, I could crisscross this, right? Crisscross this and do the same thing. Try and slide my shoulder blades forward. All right, so again, 12 to 15 repetitions, a high number, working on endurance and control, pushing that shoulder blade forward without hiking the shoulders up to your ears. And then we want to do 3 to 4 sets of this. Okay, so that's the serratus anterior. The lower trapezius basically takes the edge of your shoulder blade and then kind of pulls it down and back. So it's basically kind of like a Y position, right? As we're doing this angle, we don't want to necessarily come up to this. If we're trying to push something overhead, Certainly, we can have a little bit more upper trapezius work and support, but when we want to isolate the lower trapezius, we want to maintain a lower shoulder blade position and really squeeze the shoulder blade back and down. So then it's this diagonal, back and down. If I want to do it with the band, again, I'm just going to have this band attached in front of me, and then I'm going to take this in that diagonal overhead and then pull it back. So this is attached in front of me. I'm pulling that shoulder blade back and down, trying to pinch that shoulder blade down and back, not like up like this. Okay, so same thing, controlling the shoulder blade. It's a smaller motion, doesn't have to be big, right? So I'm not like overextending or I have to borrow from my back. I'm just going to what my shoulder range of motion is and focusing on that shoulder blade position. Okay, so a couple other more advanced exercises when we're talking about overhead athletes and throwing and plyometric movements, talking about speed and power. If I want to throw something really, really fast, I have to use a lot of bigger muscles, but the body can only move as fast as it can slow down. So you can't have a car without any brakes, right? So think about right here, I have this ball. This is a 2-pound little soft medicine ball. And what I can do is work on deceleration of my arm to try and activate that timing and strength of the rotator cuff as it stretches, as it elongates. I don't want it to stretch and just be all loose. I want it to stretch and then kind of be like a stop. So one simple thing is just holding this out, maybe like out in front, slightly out to the side, kind of like at this 45-degree angle from my body. And then I drop and catch it. I basically try and organize my trunk, my shoulder blade, get that on, get that tight, hold this, and then I'm just dropping it and trying to catch it. Oops, I dropped it. So we want to work on slowing down the ball, right? So I'm dropping it from height and then I'm trying to decelerate really quick, right? So the heavier this goes, and then the more I do this repeatedly for like maybe a minute to 2 minutes, we work on speed and that plyometric capacity of that tendon and muscle to decelerate the arm. So I let go and I try and catch it, let go and try and catch it, let go and try and catch it. So I do that really quick over a minute. And you can kind of get into a lot of other directions with this, a little bit more advanced, like throwing and catching at the same time overhead. Another one, I don't know if everyone has seen this, but this used to be popular back in the early 90s. This is a body blade. I picked this up off of Facebook Marketplace one day. Basically, it has these little weighted ends here. And if I take my hand and I grasp this and I kind of, hopefully you could see this on camera, I get the ends oscillating. It's kind of like a shake weight, but not like a shake weight. It's basically working on dynamic stabilization of my shoulder, my core, my trunk, my shoulder blade, everything kind of that we talked about before, contracting and relaxing and controlling, decelerating, creating power quickly. So I can do the same type of thing, flapping this thing up and down, kind of working on my shoulder blade position, posture. And then the good thing with this is that I can put myself in positions that was required for my sport. Let's just say, for example, pitching or overhead throwing. I can get into that position that I'm going to throw and then activate those shoulder muscles and then work through a motion like a throw and then come up and out. It's pretty tough, activating all my core and my shoulder scapular muscles through that range of motion. So that's the body blade. I think you could pick that up off of Amazon for a couple bucks as well. All right, so it is almost 1:30. Let's kind of pull up our chat. Oh, you're welcome. You're welcome. Somebody said thanks for a great session in the chat. And that's what I'm here for. I want to be able to give you as much information and the tools so that you can maintain your body and be as durable and resilient as you can. All right, if you have any questions, give it in the chat right now and give it a 30-second countdown. If not, we're going to close it out and have everybody enjoy their day. All right, so anyway, thank you for joining me today. Let me see here. I will, well, there's a question. With the shoulder exercise, I tend to get some fatigue in muscles below the clavicle. So like this region, again, there's a pec minor and pec major in that area. A lot of times if you're compensating through those bigger muscles, we're not activating those smaller muscles. So you might have to lighten your load or really pay attention to your body mechanics as you're trying to do these rotator cuff muscles. There's a lot of things that can go wrong because your body seeks this path of least resistance. Whatever is strong, you're going to use it, and whatever is weak, you're just going to work around it. So got to be, supervised maybe, and then kind of be very targeted. All right. So I want to thank everybody for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I will be back Tuesday, February 18th, and we're going to be talking about strengthening the core for overhead athletes. Okay. We're going to be discussing the importance of core stability in athletes who perform overhead movements. We're going to learn exercises that connect the core with the shoulders and the hips to improve power and prevent injuries. All right. If you have any questions, feel free to email me at paul@par5pt.com or team@betterspaces.com. Thanks for coming and be well.